I'm Marco Lupidi, professor of ophthalmology at the Polytechnic University of Marche in Ancona, Italy. I'm a medical retina specialist and VR surgeon. Subthreshold laser treatment is a therapeutic approach that is able to obtain the resolution of different exudative maculopathies or different exudative phenomena by delivering a low-intensity energy and without causing any visible evidence of retinal damage. We don't need to have any visible scarring of the retina to obtain a certain efficacy. This is the principle of subthreshold laser treatment is exactly the opposite. And we have more and more evidence that with non-visible treatment of a certain area, we can obtain a similar result compared to conventional photocoagulation treatment. This approach is extremely effective both for intraretinal and subretinal fluid without any effect or on the retinal pigment epithelium or on the outer retina. The subthreshold laser treatment is my treatment of choice in different pathological conditions. I both treat in different conditions affecting the whole neuroretinal structure, like diabetic macular edema or macular edema following retinal vein occlusion, and also obviously in all the conditions that may lead to serous neurosensory detachment that might be from one side diabetic macular edema, from the other side central serous chororetinopathy, to have, for example. There are specific patterns that we use and a specific approach with subthreshold laser treatment that substantially limit the risk of any scarring of the retina. From one side, both by using the titration approach or by using a fixed approach, we can obtain great results without any risk for the outer retina. And these results are driven by the mechanism of activation of RPE by inducing heat shock proteins and producing all the factors that are going to limit any inflammatory process. At the reverse, laser treatment that is not in a subthreshold manner may cause a risk, so we have to perform it carefully in specific focal targeted points of the retina, like microaneurysm in extrafoveal areas. We have in our armamentarium different approaches to treat exudative maculopathies. And subthreshold laser treatment is one of my favorite ones because we can obtain great results without any risk of long-term damage for the retina. The approach is non-invasive, extremely rapid. It may be repeated within the time, also for serious neurosensory detachment like central serous chororetinopathy or for diabetic macular edema, to control the disease, to reduce the leakage, and obviously to obtain functional results.